Hello everyone, I am Chris Krepling and I'm here today to talk to you about the use of caffeine and performance for athletes. Right now I'm going to talk to you about a little bit what caffeine is. Caffeine is one of the most widely consumed drugs in the world. It's found in many foods, beverages, over-the-counter drugs. I have a couple examples for you. Soft drinks such as Coca-Cola, chocolate. Cocoa is a natural caffeine. Coffee. We have some tea. And also it's found in medications such as headache medications, Excedrin, different things like that you can find over the counter as well. So what does caffeine do to our bodies? It can impact the central nervous system. It can affect our sleep, reaction times, feeling of alertness, nervousness, and feelings of fatigue. Some of the benefits that we see with caffeine: it can increase our metabolic rate. It helps us to burn calories. However, research has shown that there's no real influence on body weight. It has shown improvement in endurance performances, such as when an athlete is performing 70 to 75% of their VO2 max for around 15 to 100, all the way up to 120 minutes, and also when we are working our bodies to physical exhaustion. And also, we have seen in our bodies an increase in the secretion of endorphins, which can decrease the perception of pain, which is why some medications now have caffeine in it. Also, it can help us to increase our number of repetitions till failure and can delay that onset of fatigue as we do resistance training exercises. Some of the disadvantages and myths that we've seen with caffeine: there's a lot of misconception out there. They talk about how it can increase our heart rate and our blood pressure. However, they found that research has found that chronic ingestion has little to no effect in the long run. However, too much caffeine can affect us in many different ways. In fact, if you take too much caffeine, it actually does not show any improvements in performance whatsoever. As any drug, just like the over-the-counter medications I've shown you, you can develop a tolerance to it. Also, it can become an addiction. You can crave it, that sort of thing. You can also have withdrawals from it, which is sometimes where you'll get a caffeinated headache. If you've consistently taken caffeine and all of a sudden you withdraw from it, you can actually get a caffeinated headache. The timing of caffeine can also play a negative effect, such as if we take caffeine close to our bedtime, it can cause sleeplessness, some sleep disorders. Also with caffeine, there are what's called responders and non-responders. Some people respond differently to caffeine than others would. Some take a higher dose, some take not as much to really see the effects. However, it kind of depends on the levels of caffeine that are being ingested at a given time. Athletes that can benefit from it: endurance athletes or athletes looking to delay the onset of fatigue during their workouts or their training. One thing that the research has found is that it does not help to improve a 1 rep max in a bench press, that sort of thing. However, it does help to increase maximal repetitions, so delays that onset of fatigue throughout your workouts, so you're able to last longer, that sort of thing. As far as NCAA guidelines, so this is a big one. NCAA guidelines for its use: it is not a banned substance. However, it is banned up when you get to a certain amount. So our daily social habits allow us to drink caffeine, ingest or consume caffeine. However, once you get to a certain amount, that is where the NCAA steps in and considers it a banned substance. So for student athletes, if their urinary caffeine levels exceed 15 mcg per milliliter, it could result in a banned substance. Normally, for a social aspect of things, consuming that much caffeine is very, very hard to do through food and through beverages. However, it is equivalent to what would be about 17 caffeinated soft drinks. So to drink 17 of these would be to reach that banned substance level. So it seems like a lot. However, there have been some athletes in the past that have reached these levels. Also, you think about this as just a simple soft drink. The amount of caffeine that's in an energy drink, or such as a Monster, that sort of thing, are much higher than what would be in a typical soft drink. So consuming several of those can definitely have an impact. The dosage that is recommended upon current research to see some type of performance related enhancement: a dose that can be anywhere between 2 to 3 milligrams of caffeine per kilogram of body weight has shown significant increases in performance. However, higher doses in a caffeine have not. So sticking around at 2 to 3 milligrams of caffeine, which is roughly about 2 to 3 cups of coffee, that sort of thing, has shown additional benefit. Also, like I said, there's people who are responders, non-responders, and also you can develop a tolerance for it. If you develop the tolerance for it, sometimes it's best to even step away for a while from using the caffeinated beverages and then come back to it. It also depends on your tolerant or your how you respond to caffeine in general. So if you are not responding as much to the 2 to 3 milligrams, you might have to do 4. However, once you get up past 6 milligrams, it just starts to become too much, and you're not going to see the effects that you want to. In fact, you could see some other side effects, such as the alertness, that sort of thing, where you are having trouble sleeping, and then also you're having issues with your stomach issues and stuff like that as well. But a reasonable starting point for anybody would be 2 milligrams of caffeine per kg of body weight as you go into performance.